Well, good morning, everyone. And once again, welcome to another live this morning, and hope you're having a great day. Great start to your day here. And we'll wait a moment here just to say hello to a few people. Donna, Michael from Wawa, Nick is on from our staff. Nativity, good morning. Andrea from Niagara Falls. And Linda. How are you, Linda? I hope you're having a great day. Mary Jane from Connecticut. Joanne. Nice having you on this morning. Good to be with you guys. Okay, we're going to talk about a few things this morning. Joss from Sturgeon Falls. Micheline, good morning. Susan, or Suzanne, Madeleine from Temiskaming. Good to have you guys on this morning from La Belle Province. Nellie, Anita from Ireland. Anita, it's nice to have you on with us this morning. Debbie from Ohio. We appreciate it. Wisconsin, Holly and Vicky. Coast to coast, Canada and the United States and Europe. Jeanette from our staff. Shelley from Manitoba. Louise from Cornwall. Nice to have you guys on. Catherine from Newfoundland. Great to have you guys. Okay, George from Rockwood. Mary, good morning to you. Okay, we're going to look at a few things this morning. Connie, and I'll come on afterwards. Sandra from Brampton, sunny Brampton. Okay. And I'm from sunny Sudbury. It's sunny this morning. Frida, good morning to you. Bill. Okay. We appreciate you guys coming on. Okay. And Fran from Tilsonburg. Denise. So many. Thank you very much. We appreciate it. Okay, let's get going. And then I'll come on. Natalie, good morning to you. Lori. I hate to stop. Okay, here we go. Why do we see so much, and then we'll fill in the blanks, why do we see so much more today than we ever used to see of a lot of things, okay? It's incredible. You would think that in the year 2021, there'd be an improvement in almost everything, especially coming from medicine, coming from in terms of health. And some things are better, okay? Some things are better, but most things are not better at all. As a matter of fact, they're a lot worse. And one of them, because I get asked this, I'm not going to say daily, but 3 or 4 times a week I get asked this question, because when people are sending me their blood work or they're asking questions, one of them is, why do we see so much more of a condition called hemochromatosis? Now, that's a big word. You know what it means? Increased iron levels, okay? Now, there's a lot of people who are on the opposite end of that, and they have anemia. I see that every day. I look at blood work, a lot of people are anemic. And they can have anemia for a couple of reasons. One of them is low iron. They're not absorbing it, or they have low B12 levels, okay? So B12 deficient anemia is very common. And again, medicine's not good at picking it up because they rely on blood work that, blood work for B12, for example, is 100 years old, okay? But there is a lot of accumulation in a lot of people of iron. And they call that hemochromatosis. And what that is because of liver. It's the liver. You never told that, but it is. It's the liver. The liver is picking up too much iron. Why would it do that? Because the vast majority of people in North America, have metabolic syndrome. Okay, what is metabolic syndrome? High blood pressure, belly fat, obesity, high triglycerides, low HDL, high levels of uric acid, and high what we call fatty liver. And fatty liver is at the root of hemochromatosis. So if you know anybody that's accumulating iron, one thing that they will do, one of the medical treatments is to go and give blood. You take your blood out of your body. Now, medicine learned, over 100 years ago, don't take blood out of your body, give blood. Because the life of the flesh is in the blood. Medicine, I'm going back a couple of 100 years, they used to do bloodletting. It had been going on for centuries. They were taking blood out of the body. Why were they doing that? Because they figured, well, disease is in the blood, let's take the blood out. But if you go to the hospital today, unless you have hemochromatosis, they're not taking blood out of your body, they're giving you blood. They're giving you transfusions, and transfusions have saved millions of people's lives over the years because they should have read their Bible. If they read the Bible, they would have realized you don't take blood out, you give blood. Okay, now that's besides the point of what we're talking about, because they do take blood out of your body with hemochromatosis. But I tell people, look, you want to get rid of that, get rid of your fatty liver. Get rid of your fatty liver. Because fatty liver is what causes the accumulation of iron. When your liver is gummed up full of fat, not only are you going to elevate your triglycerides and lower your HDL, which is very unhealthy, it all starts in the liver. And so does diabetes. Diabetes doesn't start with the pancreas. Diabetes starts with the liver. Why do we see so much more hemochromatosis? Why do we see so much more diabetes? What are they saying now? 50, 60% of the population is diabetic. And guess what, guys? Guess what? It's higher than that. Because if you have metabolic syndrome, you're really effectively a diabetic. Remember what we've been teaching at the Martian Clinic is we call it the lagging indicator. The last thing that's going to happen in your body is your blood sugar is going to go high. Why is that? Because everything in your body fights to keep sugar out of your bloodstream. So, oh, doc, my blood sugars are normal. I look at blood sugars, but I don't rely on blood sugars. Because it's the last thing. Oh, I'm not a diabetic. Yes, you are. You're a carboholic. You really are a diabetic. You have elevated liver enzymes. You're a diabetic. Because it starts with insulin. And insulin resistance, one of the first factors in that is that the liver starts to get gummed up. Because remember, when you're eating crappy carbs, they're going to be turned to sugars rapidly, and they must be stored. And one of the places that your insulin loves to store your sugars is in your liver, and they are stored as glycogen, fat, glycogen, triglycerides. What are they? Fat balls in your bloodstream, and they come out of your liver. when the liver is full. So this is why we see, conditions like, oh, how come I have extra iron in my blood, which isn't good for you, by the way. But you have to get to the root cause of that, and that's your liver. Empty your liver, you'll empty your iron. How do you empty your liver? Well, within 7 days, and this is why I'm always preaching. Don't give up on the reset. It's not easy. It's not an easy diet. It's simple, but it's not an easy diet if you are, and I saw someone yesterday on Facebook, on our private group, talking about calories. I don't go there. I don't care about calories. What has calories got to do with anything? They have nothing to do. That's the food industry. Oh, just eat a balanced diet and, count calories. Calories in, calories out. Eat less, move more. That has been the motto of the diet industry for the last, as long as I've been in practice, which will be next, well, I have to remember, I'm not in private practice anymore, but I was for 46 years, okay? And in May, it'll be 47, and now slightly over a year of teaching rather than private practice, okay? But I always taught that. I taught even to my individual patients, okay? It's very, very important. It's not calories in and move, calories in, calories out, and get on the treadmill and just burn off calories. A lot of people, if you go to the gyms today, they're still doing that. And I tell them, look, you can't out-exercise a bad diet. You just can't. Maybe when you're 15, but not if you've got any kind of metabolic deficiency. You're not out-exercising a bad diet. You can't do it. And a bad diet, it's what you eat. It's not how much, it's what. It's what fuel you're giving your body. What fuel are you giving your body? Is it logs on the fire? Is it rocket fuel? Is it nutrient-dense food? Or are you just counting calories? This is why I never liked calories. Who cares? Give your body the right fuel and it will know what to do with it. If you give your body the right fuel, your liver will never get stuffed up with fat. It won't. When you eat eggs, meat, and cheese, your liver is on a holiday, man. Along with your pancreas. Now, the organ that's working a little bit is your gallbladder. And I get that question all the time. I don't have a gallbladder. Can I do eggs, meat, and cheese? Yeah, you can. You might have to take it a little bit easier because you don't have a gallbladder. But gallbladder is not what produces bile. Your gallbladder is a reservoir for bile. So when you don't have a gallbladder, yeah, it's a little bit more difficult till your body adjusts to it. But your bile is made in your liver. And again, when you empty your liver, when the reset is aiming at your pancreas, at your liver, but they work together. And once you empty out your liver does 600 things, by the way. You can't live without a liver. Now, isn't God wonderful? The liver can regenerate. Cirrhosis of the liver. This is what we used to see in the 1970s. I'm not kidding you. I'm not pulling your leg here. Do you know that in the 1970s, if you look at any of my textbooks that are in behind me and on the side shelf over there, if you look at any of my textbooks in the 1970s, can I tell you something? You will not find NAFL, okay? What is that? Non-alcoholic fatty liver. You won't find it. It's not in our textbooks. They've had to, and now they're saying like 50, 60, 70% of the population have some form, and even in kids, some form of fatty liver. Fatty liver. It used to be cirrhosis of the liver. Alcohol. Alcoholics used to get cirrhosis of the liver. Very deadly. But now, not that you get cirrhosis now. You can, if you don't empty that liver of its fat, and your body tries to, by sending that fat into your bloodstream with triglycerides, which is extremely dangerous for your heart. It ain't cholesterol, it's triglycerides. Those are the lipids, and I don't care how many times I have to repeat it. If you want to send me your blood work, I'm not interested in your total cholesterol. Your doctor's interested in that because that's what they've been trained. But only since the 1980s. Do you know that? They weren't trained in the 70s the way I was trained. We used to look at triglycerides. Now they look at LDL and your total cholesterol. Because the pharmaceutical industry has taken over medicine. They sponsor everything. Oh, let me just see if I can find... I sort of flagged this yesterday. I want to show you something. Let me see if I can find it. I think Pfizer, they're famous right now, okay, because they've come out with a vaccine. But let me just see if I can get this study here. Hold on a minute. And because I flagged this yesterday, incredible. They were fined not $1 million or millions of dollars. They were fined billions of dollars. Oh, here it is. Here it is. Pfizer received the biggest fine in U.S. history. $2.3 billion for bribing I'm just reading you the headlines. This happened in 2009. Pfizer received the biggest fine in U.S. history of $2.3, not million, billion fine for bribing doctors and suppressing adverse trial results. I'll tell you what I'm going to do. I'm going to post that on our private Facebook group, okay, so that you can read it for yourself. But why is that important? Okay, do you think Pfizer was the only one doing that? And the FDA made Pfizer an example of Pfizer. They $2.3 billion fine. Guys, for pharmaceutical companies, that's chump change. Anyway, it doesn't matter. It's a big fine. But why did they fine them? Because they were bribing doctors and suppressing adverse trial results. $2.3 billion. But the point I'm making is that in the 1970s, cholesterol wasn't a big thing with heart disease. It was coming, but it wasn't until the 1980s with the introduction of statin drugs, right? Lipitor, the #1 selling drug of all time. It made more money for Pfizer and all these other companies. They started coming out with statin drugs, and they had to produce a new test, one that nobody even used to look at, and I mean that. And it's called your total cholesterol, or your LDL cholesterol. And because statin drugs lower your LDL, the world went hook, line, and sinker for something that doesn't cause heart disease. And here's the proof. Heart disease kills more people today than it ever used to. Do you know that yesterday in the United States, 2,400 people died yesterday from either from a heart attack or a stroke? Folks, this comes from the insurance industry. You know one thing about the insurance industry? It's all risk. They know their risk. You know, you get an insurance policy or whatever, insurance companies are all risk. They calculate, they know, you know, how many people die. Well, I can give it to you. I memorized it. Yesterday in the United States, okay? Here's what the insurance company tells us. 2,400 people die every day, 365 days a year, of heart disease or stroke. 2,400. 1,600 and change died of cancer yesterday. We're not talking about that because all we want to hear about is how many people are dying from the virus. But yesterday, 1,600 people died of cancer, and a lot of them were alone. No, don't get me started on that. That bothers me. And yesterday, there was 400 people yesterday that died of Alzheimer's in the United States alone, and 300 and change died of diabetes. Now, you know me. I connect all of those. This is why when I connect hemochromatosis, it's really diabetes, but you just haven't been diagnosed with it. Because the lagging indicator is sugars. You know, oh, my blood sugars are normal. Well, first of all, they're higher than normal. But they're not enough to call it diabetes. When you look at A1C, oh, doc, it's not my A1C. That's an average. How do they do that? Well, hemoglobin lasts 4 months. Okay, because every red blood cell in your body, right, you get new ones every 4 months. And what sugar does is it attaches to your red blood cell, the hemoglobin in the red blood cell. It never lets go. I think that's a song. Never let go. Anyway, it doesn't matter. All I'm saying is that's how they calculate it, because they can tell how much sugar is attached to the hemoglobin, and they take an average because they know it lasts so long, and then they give you a number. But they don't really, if it's under 5, under 6, it's not normal. When I see 5.5 A1C, man, you're a diabetic. You're on the Titanic. You got any kind of fatty liver, you're on the Titanic. And what we're missing, is It's food. Everything that I just talked about. Heart disease, it's not genetics. Well, even if it is a little bit of a genetics, you can override genetics by changing your diet, changing your lifestyle. You can override genetics. Look, we're all going to get sick eventually and die. Okay, I got that. But in the meantime, we need to take care of ourselves. And the thing that you can control, you can't control everything. You just can't. But you can certainly control what you eat. And this is, it's amazing. People in the healthcare field, including dietitians, God bless them, they know so little about nutrition. It ain't salt, it's sugar. It ain't fat, it's sugar and carbs. It's bad fat that comes from sugars, or when you're eating crappy carbs, you're eating those vegetable oils that we talk about are very inflammatory. And inflammation, when it gets out of control, starts to damage blood vessels and this and that. This is why you have the connection of all these disorders. They're connected. It's not calories. It's not calories in and calories out. Has nothing to do with calories. It has to do with what type of fuel you're using. And I'm 100% focused in. I focus in, guys, on your pancreas. I focus in on your liver, because if I focus in on your pancreas, getting insulin down and emptying your liver, I can tell you your body will turn itself around. And I don't care if you're 80 years old. No, it's going to be slower. Okay? But I'm telling you, it's a secret. I want to teach that. I know you guys are, when you follow along with me, I'm teaching you. It's something that 99.9% of all medicine, they don't know this. They're still hung up. Oh, you can't eat red meat. Red meat is bad. It's bad. It's acidic. It causes heart disease. It's full of fat. True or false? Isn't that what you're hearing? Even today. True or false? And what I'm saying is, they're looking for love in all the wrong places. Name me a disorder. And if you don't see a connection to food, I can't help you. There's a connection to food. By the way, I wanted to say this right at the start. I forgot. We've renamed SIBO. Okay, that's the medical term. Small intestine bacterial overgrowth. Nope, it's SIFO. Small intestine fungal overgrowth. That's the one. I'll tell you, I'm a senior citizen. That's the one I remember. Okay, I like the other one, SICO and CEO. Nobody likes CEO. Yeast overgrowth. But it's a fungal overgrowth. And you know what? We're bad at fixing it. Medicine is bad at fixing heart disease, at fixing fatty liver. They're bad at it. And these are the, as I said to you, it's the elephant in the room. One thing we didn't learn out of all this, you guys learned it, but through this whole pandemic, we didn't learn the lesson that we should have learned. We didn't learn anything. Oh, just keep doing what you're doing and wear your mask, wash your hands, and social distancing and this and that thing. But we didn't learn a thing about food. We should have. Anybody that got sick, just about 99% of them, unless they were well over 80 years old, and even then, they had to have these pre-existing conditions. And what were those pre-existing conditions? The pancreas and the liver. Because the pancreas, insulin, affects your heart. It affects your blood pressure. It affects your blood sugar. You don't get fat from eating eggs, meat, and cheese. It's an impossibility. You don't, because it's not calories. It's not calories. It's not calories. So why do we see so much of these things today? That's the topic today. And we talked about hemochromatosis. We talked about how the liver, it does 600 things. You better empty it. So that, you see, one of the biggest things that the liver does, think about it with hemochromatosis. You see, iron is if you eat steak, you get good heme iron. Oh, and then yesterday, actually, I read this because somebody said, the doctor told me stop eating red meat because I had hemochromatosis. I got a headache. I got a headache, honest. As soon as I read that, I got a headache. My blood pressure is going up because it's the exact opposite. Because red meat, well, the doctor's right, because red meat has the best iron. Yep. So you got too much iron? Let's stop eating it. Yeah, but no, it's the liver. Empty the liver. The reason you had too much iron is not from steak. It's because you ate too many carbohydrates. 100%. No exceptions. Eat all the steak in the world. You're not going to get hemochromatosis from eating steak. It's the opposite. You're getting it from eating bread and pasta and rice and cereals. That's why we see so much of it today. Yeah, it's not steak. It's sugar. Nothing but fun. Nothing but fun. Okay? Okay. We are going to, tomorrow is question and answer. Okay? So, we appreciate all your questions. I know some of them have already come in because I've seen a few. Okay? And that's good. I'll try and answer all of them tomorrow. Martin Clinic Facebook group, okay? Enjoy, okay? We want you to join, family and friends, okay? It's a great community. The reset, see my little thing? Because I was going to talk about that section there. Okay, I'll do that another day. Okay. We love you guys, and I'll go on and say hi to you afterwards. Talk to you soon.